I call the honourable member for Bowman.
Deputy Speaker, it is an affliction on this other side, an affliction with the free stuff. And I know that 30 years ago there was a leader of this country who wanted free healthcare, but, you know, not just Australia, but the entire world has moved on. It was an interesting meeting for me in 1997 when I got my chance to meet the great man, Gough Whitlam himself. And no, it wasn't out in Western Sydney, Deputy Speaker. It wasn't in a public hospital. It was in Australia's finest private hospital. And he certainly had no problem with the fine system that we have of public and private hospital provision. Now, let's be honest. We have a system where there's choice. I have no problem with both sides of this chamber exercising choice. But don't for 1 minute be so misguided as to think that the Medicare levy pays for Medicare. We've had 2 Labor spokespeople now say that the $10 million we collect from the 1.5% actually pays for Medicare. So I suspect then I'm going to now be hearing a Labor government prepared to rule out or otherwise an increase to the Medicare levy to pay for Medicare. That's right, double it. I mean, the Medicare levy costs us all around $500 a year. If you're earning about 100 grand a year, an extra $500 for every 10,000 you earn on top of that. That can add up over time, $50 for every 10,000 above that, and that is what those higher income earners pay into the system, but only pay for half of the cost of Medicare, going from $9 to $18 billion over the last 10 years, up to $34 billion over the next 10 years. Now that's a challenge, to bend the cost curve. Every economy in the world is working on bending that cost curve, except the poor, unfortunate Labor Party, riveted, welded, stapled to this notion of free healthcare because their great leader said so in '75, and that lot are stuck with the notion, unable to review it, unable to reconstruct their thinking because it's all about the free stuff. Now let's keep in mind, right throughout the known world, and particularly here in a developed system like Australia, people without financial means are bulk billed and will continue to be. It will never be compulsory to charge a co-payment. That co-payment is still less than a Macca's meal deal, a quarter-pounder mid-sized meal deal. And I tell you what, the smartest, most talented, hard-working professionals in this community are worth $7 to spend some time with and look after your health. They are worthy of that payment. Now, don't take it from the doctors on this side. Don't take it from the doctors or the health planners. Talk to the doctors on your side. What? There's no doctors? Where are those doctors on that side? Not including you over there, Dr. Gillespie. Give me Dr. Lee over there. One of the finest minds who under any other system of merit would be Treasurer, Opposition Treasurer by now, but not in the Labor Party. That fine Dr. Lee said we need a moderate co-payment, not enough to be a dent in your pay packet, but enough to make sure you think before you go to a doctor. Perfectly said, Dr. Lee. Come and join the doctors over here and let's have a world-class health system. Now let's be honest, bulk billing is still absolutely endemic in diagnostic radiology, still endemic in pathology. As long as those requests are on the same form in pathology, there is only the one co-payment charge. 2/3 of all items under Medicare when you see a doctor are exempted from the co-payment. Any of the chronic disease items are co-payment exempt. But no, let's go back to that Labor world. That was where they used to promise you the free stuff in the form of a super clinic, except they only built 33 of the 66 of them. And what were those buildings doing? Long before they could even find a GP to steal from the neighbouring general practice, because that's what they did, they turned all the lights on. That's right, up in the member for Petrie's area, no working super clinic, just turning all the lights on with a big cross out there. Delivered, a super clinic. Undelivered, staff in it actually doing some work. And of course we have the PBS co-payment, which right now Australians pay around $6 to fill out a script. But this lot won't pay the same amount, virtually the same amount, to go and see the highest trade professionals in the health system. And don't forget, who was the architect of the pharmaceutical co-payment? LABOR. Who tried to double the pharmaceutical co-payment without success? LABOR. How much does that add up to over time? 60 scripts at $6. That sort of adds up over a while, doesn't it? But oh no, we can't have a $70 maximum capped out co-payment to see a doctor. The argument is so thin, the argument is riven with holes like Swiss cheese. Let's move to private health insurance. That's right, you're quite prepared to nickel and dime average Australians, making health insurance more expensive. Out go the ancillaries. Home come the allied health professionals from regional areas because there's no work anymore. How much does that cost a patient to ensure the continuity of their health care? It's a Labor government welded to the past, welded to the ideas of Whitlam, and not keeping up with the future of a sustainable Medicare.